Now, new guidelines for consumers about sunscreen. After more than 3 decades, the FDA announced a series of changes in what consumers will see on all sunscreen labels by the summer of 2012. Among the changes, makers of sunscreen lotion will have to clarify whether their product protects against what's known as UVA radiation as well as UVB radiation, which was already the case. If it does not protect against both, the manufacturer cannot say it protects against skin cancer or early skin aging. Sunscreen lotions will also no longer be able to advertise that they carry an SPF or sun protection factor of greater than 50. Well, for a closer look at the changes and what people need to know, we're joined by Dr. Ali Hendi. He's a dermatologist with the Skin Cancer Foundation. Dr. Hendi, thank you very much for being with us.
Thanks for having me, Judy.
So I've mentioned a couple of them, but in your own words, what are the main changes that people should look for with these new regulations coming out next summer from what exists now?
Judy, these are welcome changes from a perspective of dermatologists that care for patients with skin cancer. Number one is a product has to have UVA and UVB protection to be labeled as a broad spectrum. Up to now, it's mostly been UVB, but UVA is a critical factor in development of skin cancer and sun damage and aging. A product cannot label itself as being waterproof or a sunblock. Those do not exist. There's no ingredient that's a total sunblock, and there's no product that's waterproof. So those are some of the main changes.
But we've seen a number of skin lotions. We just put a couple of them here as an example. That still claim that they are waterproof.
They do, and these provide a false sense of security for consumers. Consumers need to know that if they're outdoors, they need to apply their sunscreen every 2 hours. If they're swimming or if they're sweating, they need to apply after they come out of the pool or the water. And there's no such thing as a sunblock. Sunscreen is only one ingredient that helps you protect yourself from the sun. You should seek shade when you can. You should wear protective clothing, sunglasses, hats. Those are all a package that help you protect your skin.
So you're saying nothing truly protects skin totally from damaging sun?
There's no total protection, but you could make smart choices that'll minimize the damage.
Explain to us, Dr. Hendi, what's the difference between these UVA and UVB rays? There was already protection supposedly against UVB, but what's the difference with those in the ultraviolet A rays?
Sure. So UVB rays are rays that are blocked by the glass in your car, for example. They don't penetrate very deeply. UVA rays penetrate deeply, and they're known to cause skin damage. Both UVA and UVB are responsible for skin cancer. So that's why it's paramount to have protection from both UVA and UVB. So
what does this mean when the consumer goes to the drugstore and you look at the shelf and there are dozens, hundreds sometimes, of different brands and types of sunscreen? What does the consumer look for now?
It's really challenging for a consumer, and I get that question every day from patients, what should I look for? These guidelines would help, but for the time being, look for a product that has UVA and UVB protection. It specifically says UVA protection. A product that has SPF 30 or higher, and make sure you apply that product before you leave the house, and then if you're outdoors, you reapply it every 2 hours.
You are, as we mentioned, a dermatologist. You follow this closely. What do you see in your patients in terms of sun damage as it's changed over the years?
I'm seeing more and more young patients with skin cancer. It used to be that skin cancer was a disease of the elderly. You had to be over 40 years old to get it. Every day and every week, I have patients in their late 20s, sometimes even in their late teens or 30s and 40s with skin cancer. And the damage that we're seeing today is not the damage from last summer or the summer before. This is the damage from 10, 20, 30 years ago that's popping up now.
And I was reading today that it often is affecting young women as much as, if not more than, young men.
There was a study that showed that the rate of skin cancers in young women is increasing more rapidly than men. There's a lot of reasons for it. One of the factors is definitely sun exposure and tanning beds. Young women are known to use tanning beds more often than men, and that could be a factor in young women having a much higher, rapidly growing rate of skin cancers.
Do you urge your patients not to use tanning beds at all?
Absolutely.
Why not?
Because you're damaging your skin. You're paying somebody to damage your skin. Tanning beds are the tobacco of 20, 30 years ago. That's the stage we're at now. The WHO recently claimed or labeled...
It's the World Health Organization.
Exactly, the World Health Organization. Tanning beds or UV radiation as a known carcinogen. If you know something is a known carcinogen and that's a product that causes cancer, why would you pay to be exposed to it?
So just quickly, you do expect these new rules to make a difference?
I sure do. And before patients had to go to a dermatologist to seek recommendations on sunscreens, I still recommend seeing a dermatologist for a skin check, but consumers are going to have an easier time picking the right product off the shelf once these new regulations go into effect next summer.
Dr. Ali Hendi, we thank you very much for being with us.
Thank you, Judy.